everyone. So let's talk about implant components today. Imagine you are ordering a pizza. The pizza comes in a box, not directly in your hand, right? Similarly, an implant crown also doesn't sit directly on the implant. There are few middlemen involved. So today we are going to meet all these VIPs. So by the end of this lecture, I'm expecting that you'll never get confused between a healing cap and a healing abutment. So let's start with our first component. The first component is the implant fixture, that is the implant. So this is the real hero of the story. It is the only component that goes inside the bone. It is the only component that goes inside the bone. So almost all modern fixtures are made up of commercially pure titanium or titanium alloy, because titanium is highly biocompatible and forms a direct bond with the bone through osseointegration. It is an only component that goes inside the bone, and it acts as an artificial root. So we are thorough with this, the artificial root. So my question to everybody here is, which component actually remains inside the bone forever? Please answer the question in comment box. Now we'll talk about the second component, that is the healing cap or the cover screw. Now after placing an implant, after we have placed implant in the bone, we need something to cover the implant so that nothing falls in. So this is a cover screw or the healing cap, depending on the protocol. Think of it like putting a lid on your coffee mug. We don't want unwanted things falling inside a coffee mug, right? Yes. Now comes the third. This is called an abutment. It connects the fixture to the crown. The fixture will be connected to the crown through abutment. If the implant is a foundation, the abutment is the pillar supporting the roof. It's a pillar that supports the roof, the crown. So a poorly selected abutment can ruin even a perfectly placed implant. Now the fourth part, that is the crown. And finally the patient says, "Doctor, where is my tooth?" So this is the prosthesis or the crown that restore aesthetics, function and the phonetics. Remember students, the patient never sees the implant, they only see the crown. So if the crown look bad, they don't blame the implant company, they will directly blame you. We have already spoken about it. And the cover screw. So what is the difference between the two? We have talked about cover screw in our last slide. The cover screw is something that covers the implant surface, so no unwanted thing goes inside. In stage 1 surgery, we submerge the implant using this cover screw. When we talk one surgery, we place cover screw on the implant and we submerge the implant for the osseointegration and the healing phase, so that there is no micro movement, nothing goes inside the implant too. Now what is healing cap? This projects above the gingiva. When you place the implant, we want some soft tissue healing and shaping. So this healing cap, what it does is, in stage 2, we open the implant and we put the healing cap on the implant. So it will shape the gingiva around the implant so that it will give a good emergence profile and it will make our prosthesis more aesthetics. So think of it as a soft tissue trainer. Now the quick question, if I want the implant completely hidden under the gum, which component should I use? Please answer this question in the comments. We have already spoken that abutment is that part of the component which connects implant to the crown. So this part is the abutment. So these are few types of abutment that we're going to discuss today. Starting with, not all the abutments are same. Just like shoes come in sports shoes, formal shoes and sandals, abutment also come in different varieties. So this first one is a stock abutment. Stock abutment is a ready-made abutment. It is economical and commonly used when implant position is ideal. Okay, when implant position is ideal, we use stock abutment. Now the customized abutment. This one is specially designed for the individual where aesthetic is a concern. We design it for an individual patient and it gives a better emergence profile and aesthetic, especially in anterior teeth. We can use it for posterior also in few cases when implant angulation or implant is not in an ideal position. In that cases also we can use a customized abutment. Next come the angulated abutment. This is used when the implant is tilted. If implant is not placed like this, it is placed like this, then we'll place a abutment that is angulated. Now we can place the implant easily, crown easily over this abutment. So we use it when there is the implant position is not ideal, it is tilted. Sometimes implant don't behave ideally, so we ask the abutment to do some adjustment. So this abutment does that adjustment. Now the temporary abutment. Temporary abutment is used to fabricate temporary crowns. Okay. When we give temporary crowns, we use temporary abutment. Nowadays it is used, it helps shape the soft tissue before the final restoration also. This is the gold castable abutment. This allows the lab to fabricate a custom metal abutment by casting. We do it by casting. This one we can do by CAD/CAM also. We do this by casting. But nowadays it is used much less because CAD/CAM customized abutment have largely replaced it. Alright. This one is the last zirconia abutment, preferred in the aesthetic zone, because it prevents the gray shine through seen with the titanium. Anterior tooth, titanium or zirconia? Please tell me in the comments. The impression components. Now suppose the implant is healed properly. The implant is healed properly. Healed है ये पूरी तरह से osseointegrated है. How do we send this exact position to the lab? This exact position, how we'll send this to the lab? How we'll replicate this position to the lab? For that reason, we have impression copings. Impression coping, there are two. First of all, before coming to it, I wanted to tell you there are two ways we can, although we'll discuss it in the later lectures, but in brief I will tell you two types of impressions. One is abutment level, second one is implant level. In abutment level, we'll place the abutment and we'll take the impression as we take impressions of then FPD. Implant level, we need these transfer copings, the open tray coping and the closed tray coping. Procedure, I'll be explaining how we do that in the next lectures, but this is an open tray coping and this is a closed tray coping. Open tray coping is longer, short tray coping is little shorter. Please remember this. Both the copings helps in transferring the exact position of the implant to the lab. What is implant analog? This never goes into the patient mouth. First you have to remember this. Remember, it never goes into the mouth in patient. This is for the lab. It is attached to the impression copings. We attach this replica to the impression copings, be it be closed tray or the open tray. We attach these copings with analog, then we send this to the lab make the model and pour the cast. So if you remember this sequence, half of the implant prosto becomes really easy. And if you forget this before the exam, don't worry, I'll be there to remind you again. But hopefully I can't help you with the viva. So mug it up, learn it, and I'll see you in the next lecture now. Thank you very much.